Hello, I'm Dr. Stephen Hanauer from Northwestern University in Chicago, and I'm going to be speaking today on the role of colonoscopy in the management of ulcerative colitis. There are several indications for the performing of colonoscopy in ulcerative colitis, including the confirmation of the diagnosis and separating ulcerative colitis from other inflammatory disorders, assessing the extent and severity of disease to determine the treatment intensity, therapeutic monitoring and treating to endoscopic targets to demonstrate endoscopic healing, and finally, for cancer surveillance. The diagnosis of ulcerative colitis is based on a combination of clinical, endoscopic, and histopathologic findings. There are actually very few clinical manifestations of ulcerative colitis that can be noted on a physical examination unless the patient has very severe disease and appears anemic or has abdominal tenderness. Laboratory studies are also nonspecific, but should be performed to determine the blood count and to rule out infections. But endoscopy or colonoscopy is the hallmark for the diagnosis of ulcerative colitis and separating ulcerative colitis from other inflammatory disorders of the colon. Performing colonoscopy also allows the ability to take biopsies and the histologic confirmation of ulcerative colitis and separating ulcerative colitis from other conditions. There are a number of mimics of ulcerative colitis, including drug-induced colitis, indeed from a bowel preparation itself. Non-steroidal anti-inflammatory drugs are one of the most common affecting medications that can contribute to ulceration throughout the small and large intestine. Checkpoint inhibitors have also been demonstrated to be able to cause a colitis very similar to ulcerative colitis, and other drugs such as interleukin-17 inhibitors may aggravate or actually induce ulcerative colitis. Other mimics include infections such as enteric pathogens, Clostridium difficile, cytomegalovirus, and amoebiasis. Neoplasms can also mimic ulcerative colitis and be identified at colonoscopy, including colon cancer or metastatic disease to the colon, such as malignant melanoma or Kaposi sarcoma. In women, endometriosis may actually involve the colon and cause symptoms that mimic ulcerative colitis that can be confirmed at colonoscopy. And commonly, diverticulitis or segmental colitis associated with diverticular disease is a mimic for ulcerative colitis, as is solitary rectal ulcer that can produce urgency and rectal bleeding. Another important aspect of colonoscopy in the management of ulcerative colitis is to determine the extent and severity of disease. The extent will allow us to treat patients either orally or rectally, depending on the proximal extent of inflammation. And the severity of inflammation will also dictate the intensity of treatment that patients will need. Extensive colitis, deep ulcerations are factors that are associated with moderate to severe disease and the need for advancing medical therapy. We determine the severity of inflammation in ulcerative colitis according to what's known as the Mayo score. A Mayo 0 is a normal bowel. Mayo 1 includes distortion of the mucosal vasculature. A Mayo 2 score is exemplified by superficial erosions, and a Mayo 3 by visible ulcerations that impact a poor prognosis and a greater need for colectomy and hence more intense medical therapy. Colonoscopy is used as a component of our treat to target concept in ulcerative colitis, that we treat to induce remission that is manifest by a normal appearance at colonoscopy. And we continue to monitor patients on a schedule that is dependent upon how severe they start with and how rapidly they actually respond. But we continue this monitoring as we would monitoring for blood pressure in a patient with hypertension. When we do treat to the endpoint of endoscopic improvement or endoscopic healing, we actually improve the course of the disease and minimize risks of relapse, hospitalizations, and surgery. Finally, cancer surveillance in ulcerative colitis is an indication and an important indication for colonoscopy. The cancer sequence in ulcerative colitis evolves from inflammation to microscopic dysplasia, visible dysplasia, and eventually cancer. Using colonoscopic surveillance and over the past years, chromoendoscopy that applies a dye to the mucosa and outlines dysplastic areas are very important for the ongoing care and the prevention of colon cancer in the setting of ulcerative colitis. So, assessing the disease extent and severity, confirming the diagnosis and ruling out mimics, assessing how severe the disease is and monitoring for endoscopic improvement, and surveillance for cancer over the ensuing years are all indications for colonoscopy in the setting of ulcerative colitis. I thank you for your attention.